in the upper tract and in the lower tract as polyp and carcinoma. So this is a promising technique. What happens in Apulia? Apulia is the region here. It's across the Adriatic Sea. 4 million people, 1,600,000 in the province of Bari, which is the major city. And there are 340,000 people who have 50, 70 years. Now, there is a national prevention program from 2005 in Italy, cardiovascular risk, accident prevention, vaccination program. We hope also for the last virus, not ready yet, and tumor screening. The region, each region, we have 36 regions in Italy, they took this program in accord with the central government, and we had 3 oncologic screening programs: uterus, breast, and colorectal. These are the provinces, and Bari is in the middle. Now, sorry for this slide. The incidence in Italy is estimated in this class of age 30,000 cases per year, and with a 5-year survival, 55%, I'm afraid. So from the local observatory, epidemiologists say that in Apulia, 54% were males, this age, 31 million euros expenses overall. Yearly death rate, 30%. And in Apulia, 24,000 colonoscopies are performed, at least in 2002. Maximum peak is in the province of Bari, of colorectal cancer. So this was taken as an example, as a pilot province in the whole region, because, of course, the screening was very expensive. 2 types of screening, but only one has started. 3 years, 2005, 2006, 2007, moderate risk subjects, which means first-degree relatives of patients with colorectal cancer, do pan-colonoscopy because they have increased the risk of colorectal cancer. Second project, medium-risk subjects. If there is occult fecal blood positive, then suggest colonoscopy. So this is the proper approach. Let's see first project. So there is a calculation to make, and somebody has to make this. The incidence in Apulia is 2,500 cases per year of colorectal cancer. If each patient will refer 1.5 relatives, we end up with a number of 3,750 incidence relatives every year per 3 years, and another 7,500 for the early years. So, in total, 19 subjects to screen, 10,000 procedures to organize, because maybe 50% only will accept this screening. How is the staff composed? They thought family physicians are the most important because they need to take the data. There's an endoscopy center which need to be standardized and trained for a polypectomy, a pathologist, the laboratory for interpretation of some blood analysis, a radiology when colonoscopy is negative, they have to do barium, hospital pharmacy for delivery of preparation, and some administrative staff. The flow chart. First, the government with the university is motivating the endoscopist and for the identification of colorectal cancer. Then there is some advertisement in outpatient clinics, in the hospitals, sensibilization of physicians with multiple meetings with the specialists, with endoscopists and gastroenterologists. And the physician should contact the patient, should ask for the informed consent to have access to the relatives, and should send this information to the district, and together with the operative central unit, send the letters and establish a green number for endoscopy facilities and be in contact with the endoscopist. The endoscopy unit should have a priority access. This is important because in Italy we have a long waiting list as outpatients and even as inpatients. So these screening patients should go very fast because otherwise you lose them. And you take the history, you give the preparation for the colon, and then on the colonoscopy day, you take a full history, and then you perform the colonoscopy, and then you make a decision, negative, positive, incomplete, X-ray, barium, and so on. The endoscopy center should be trained for endoscopy of polypectomy of small and large polyps. Now let's look at some results. These are preliminary because there were high expenses. The project was delayed due to bureaucracy. So the first information, some of these data are a little bit disturbing. So we should discuss this because, you see, these are the total number of family doctors who could have sent their patients. They never answer, only less than 10% in all regions of the area.